It's been 8 days since my surgery and I feel okay. Still some pain. I don't take the pain medications anymore, but can't complain. So let's start from the very beginning. So on Thursday, June 11th, we were scheduled for a C-section early in the morning, and we woke up I woke up 6 o'clock, being nervous and stuff, and got ready. And then we left the house at around 7:30 because we had to be there like 8 o'clock. So they will do the C-section at 9 o'clock. So we went there pretty nervous, like I put nail polish at the last minute and it was pretty hectic, and we went there. There were actually like 3 scheduled C-sections that day, and I was the first because the other ones came late. And the morning staff of nurses were so nice. They were really, really nice, like super. I felt like, you know, I felt taken care of. So they said that I have to lie down and they have to check me on the monitors for a while, and I said, oh please, no, please, you know, I don't like that bad and I don't want to lie down, it's too early anyway. And they said, okay, just what do you want to do? And they told us
we have a baby. Yeah, who cares? We have it all because we have it.
Amy, do you like your baby sister?
Yeah, we take it at home every time. We can't go to the hospital now.
She's such a good help. She helps to put the diaper, the changing pad, and the wipes, so I can change the baby.
Me too.
And then she throws a dirty diaper and right, baby Jen?
And it has cook and pee-pee.
Cook and pee-pee. She's like. Okay, so where was I? I'm feeding her right now. That's why.
Where was I? Oh yes, and we have her a nice blanket, like this.
Okay. Can mommy make a video?
Yeah.
Go watch your papa.
I know.
Okay, go watch. So yeah, they checked the heartbeat and contractions for a
Guys,
while.
something that you can get.
And after that, everything was okay. And they had to prep me up for the C-section because, you know, the preparation and stuff. So first what did they do? Oh, first they did the IV. Yeah, first I did the IV, and I was really, really freaking out because I had a bad experience last time with the IVs. The nurse who was trying to put it, she did like 3 times and couldn't find my vein, and I told her that, please, just don't hurt me, I'm already in enough stress. So she said that don't worry, and she did an absolutely fantastic job. I just looked away, and within 2 minutes she put it in, and I told her not to put it in my hand, to put it below, and she found my vein. She's like, it depends on your vein. So she put it really good. It didn't hurt even afterwards or during. It was in me like 2 days. It didn't hurt. And then they hooked me out to the catheter where you have to pee, and because you need it, you cannot walk right away after the surgery, and during the surgery maybe you need to go. And yeah, that was a little uncomfortable, but you know, what has to be done has to be done. What else they do? So yeah, I told them that I want my husband inside, and they said that it depends on the anesthesiologist. If he's the guy that we know, then he will let him in, but it also depends if the anesthesia works on you, then he can come in. If it doesn't, then he can't. So you know, they wheeled me. That was my first wheelchair ride, and hopefully that'll last. They wheelchaired me to the OR where they did the anesthesia.
Look,
and
guys.
Instead of giving the epidural where you don't need it, the catheter to add up more.
When you go to this better, but you get this all, and you get this all, with us all,
Okay. So they did the spinal, and I'm gonna tell you, that really was the fastest working drug on me. And I told them that I need a pillow to hug, and they could not find a pillow. I told them that I need my boppy pillow to hug it during when he was gonna put the injection, and they said that no boppy pillow is allowed in the OR, whatever. That you cannot bring anything inside from outside. So I said, oh shoot, and she said that you can hug one of the nurses. I'm like, okay, just find me a cuddly one. And most of the people I knew from the last time, like there's a Russian lady and she's super fantastically so nice, and last time she held my hand during the surgery, and this time she was just holding my shoulders and I was hugging her, and while I was being done the anesthesia, and she was talking during the whole time, like letting me know what the anesthesiologist is doing right now, right at this very second, and right at this moment. Now he's gonna inject, and you're just gonna feel a dentist like injection or something. And that's exactly what it felt. It didn't hurt at all. All you have to do is just lean back, forward, and just stay still. And let me tell you, as soon as he injected, I could feel it in my toes going upwards. Within 5 minutes, just my whole lower body was numb. And it felt so heavy, my goodness. I was like, where's my body? It feels creepy. Then I told him that last time I was shaking uncontrollably because of the anesthesia, epidural. And he just, within 2 seconds, he said that, oh, why did they didn't put the pads? I was like, what pads? I don't know. He bring those two thermal something heaters for the legs. He just wrapped it around my leg and hooked it up on something, and my leg got really hot and my shaking was gone. And that was, and after that and they were saying that should we call the husband, and I was like, oh please. They checked me, they said not yet, and then all of a sudden I turn around and there's my husband next to me. They're like, hi honey. I'm like, hey, when did you get ready? He's like, they got me ready 20 minutes before, and they said that we don't promise anything, but if everything goes well, you can go in and just sit next to her. And that was the best experience ever, because during the whole time when they were cutting and opening, pulling it, all that stuff, he was talking to me and we were looking at each other, just trying to get distracted and just concentrate on the baby. And also the anesthesiologist was giving me like, what are they doing now, if the baby's out yet, or stuff like that. So the crew was absolutely fantastic, and I'm really glad that I went back to the hospital that I gave birth to Amy. So, around 10 o'clock, they were already opening me up, and she said, because I had a lot of fluid and they had to suction out all the fluids first, and it was like sounds like flushing out everything from the suction tubes. And so after that I was like, is she out yet? Is she out yet? Is she out yet? And they were saying, no, not yet. And then all of a sudden I hear this ducky sound like, ah! She was crying very heavily and deep, and not like screaming right away. She was slowly by slowly, step, she was making fussy sounds. And she was like, ah! It feels like her mouth was full of fluid or something. That's what it felt like, but I don't know. They said everything is okay. And when they were pulling her out, like tugging, pulling, and my ribs were really hurting because they were pushing on me and so much. So that was a little uncomfortable. But rather than that, all you can feel, or not feel even, like all you can just imagine what they're doing is just the cutting sounds, snap sounds, and there's this burning smell. Probably they're disinfecting or something. I don't know. Don't want to know what they're doing. And then when the baby was out, they're like, Daddy, come, you can see her. And Daddy's like, no, thank you. He's such a scaredy cat. I'm like, go, you're so lucky to see her first, go. And he went there and standing there and like, how she look like? What does she look like? And he's like, she's white. I'm like, what do you mean white? He meant to, the white stuff, white cheesy stuff all over her. No blood. There's no blood on her. He said that. And then she started crying more and more. So I was like happy. I was like, is she okay? And they're like, yes. And then they brought her to me, the Russian nurse. She just brought her to me, opened my chest. I didn't even tell her, but I told her that I want to breastfeed, and that's all I told her. And she just opened my chest, just tried to latch her on my breast, and that was the best thing ever. Oh my gosh, that felt so good to see her right away and to even feel her on your body. It was amazing. I never felt that kind of stuff, you know, even though it wasn't an. Still, you have that. I was like, oh my god, oh my god. That was so cool. And she was trying to latch on right away, which was fantastic. I was happy.